Awesome, Mel. We are live right now. How are you?
Hey, I'm good. How are you?
Good. You've had a super busy day today, I see.
Very much so. Yeah.
Yeah. I'm super excited that you're helping so many people. I mean, I tell everyone to go to you, like my pole instructor, like anybody that ever talks to me about pain, I'm like, I think Mel can help you with that. So
Awesome. Well, thanks.
so we are streaming on Facebook, on LinkedIn, and also on YouTube. So um, I have Friendly Fridays. So anyone that hasn't been on Friendly Fridays, it's a way for me to introduce you to experts that are going to teach you things that you should have learned in school, but you haven't just yet. And Mel has kind of changed my life just a little bit. And you'll find this to be true for a lot of the speakers that I bring on Friendly Fridays, just because I've been just super blessed to attract some amazing individuals like Mel. And I can't do Mel's story justice. So I'm going to allow her to tell us about her story and what brought her to Brandon Payne Treatment Center. She is the co-owner of Brandon Payne Treatment Center. She is a neurosomatic specialist. She treats me pretty much every month if I can get in with her. And she's been able to help me tremendously with my tension here. I hate to call it TMJ because I've never been diagnosed, but it's like I am not a nice person when Mel hasn't seen me in a while. but but
I
she's
find that hard to believe, Paula. Come on now.
dude, ask Eric. So but uh but yeah, so Mel, can you tell us just a little bit about you, your story, and then we'll jump into kind of the topic of pain management and give some facts around that.
Sure, sure. Thank you. So, as you mentioned, my husband and I actually are the co-owners of this clinic, Brandon Payne Treatment Center. And the way that our story starts, you kind of have to take a ride in the Wayback Machine a little bit because our clinic has been open for around 6, 7 years, but our story begins 23 years ago. And 23 years ago, we were getting ready to welcome our first child into the world. I had a perfect pregnancy. Everything was awesome. I opted for a natural childbirth because that was really important to me. And at the very end of the delivery, things went horribly wrong. Um, we learned that Zoe, that's our daughter, her umbilical cord was wrapped around her neck. In the delivery process, her shoulder got pinned under my pelvis. And so it was kind of like on a TV show where there's like one doctor and two nurses, and all of a sudden 10 people show up. So, before we knew what was happening, there was a doctor on top of me trying to push her out and other doctors trying to pull. When she came into the world, she was not breathing. And like most babies, they come into the world and they're crying and everybody's, cheering. And she was purple and she was unresponsive. And that delivery room was silent. And thank God, the doctors were able to save her life. They resuscitated her and brought her back, but they warned us that there could be some issues. And a few years down the road, we saw that there were issues. She wasn't speaking with her peers. She had a lot of balance and coordination problems. And we were doing traditional therapies and we were having some degree of success, but she would plateau very easily. And so, simply by chance, although I don't know that there are just coincidences in life, but we met a gentleman named Randy Clark at a party. And he started working with Paul St. John, who's considered the father of neuromuscular, now neurosomatic therapy. By then Zoe was 4 and she wasn't really talking very much at all. And so, we expressed some of our frustrations and concerns, and Randy invited us to bring Zoe to see Paul. And Paul sees things that other people can't. And so he did his assessment of her posture. He looked at her body, and without us really explaining what happened in the delivery room, he could see it in the patterns in her body. And he said, I'd like to work with her. I'm going to do some work on her neck, her C1 and C2. I'm going to work on her cranium. And then you're going to go home and you're going to come back and see me in 2 weeks. And he treated her. We left. And about 5 days later, my husband is home. He's working from home. He's practicing on the guitar. And Zoe's hungry. And she does what Zoe always does. She walked over, she pulled him by the shirt and said, Papi, and he kind of said shoo because he was in the zone. And this happened a couple of times. And the last time he lost his temper a little bit. And he was like, baby, just give me a minute. He's embarrassed to say it, but I'm going to tell you. And so She looked at him in the eyes, which is something she would never do before. And she patted him on the shoulder because she understood he felt differently than she did. And she said, "It's okay, Papi. I can wait." And that was the first time that she had ever spoken in a complete thought, in a meaningful way to another human being. And when you're a parent and you've waited your whole life to be able to communicate with your child in that way, um, my husband threw his guitar to the ground. He scooped her up and he's like, "Baby, I'll make you whatever kind of lunch you want. It's on." And he was crying. He called
I'm
me
like,
at work. I know. I was a school teacher at the time, and he called me, and I got the call at school, and I'm like, "What's happening? Did something happen to the baby?" And he's telling me this, and then I'm crying, and everybody's like, "What's going on?" But in that, what happened there is that Paul really created the environment for her body to do what it was meant to do, and that was to heal. And from there, her therapies took off. Like her therapist, everything that they were measuring improved, and she just was crushing goals left and right. And so, as the years went on, she needed therapy less and less. We sought treatment ourselves for our own issues. And then one day we learned that Paul and Randy, that guy that we met, were founding a school to train people to do this. And when you've had this kind of experience happen to you, you can't help but feel a responsibility to do that for somebody else. And so we left our careers as teachers. We said, no, this is the work that we're now meant to do for the rest of our lives. And so that's what we did. And so I'm super excited because I get to make change or help people make change happen. And I remember being that parent that didn't have a whole lot of hope for what the future brought. And to be able to see that is really rewarding. I make no secret about the fact that I absolutely love what I get to do now, because I really feel called to do it.
that's an amazing story. See, guys, I couldn't have done it justice. And I mean, I've seen Zoe, and it makes me so happy to see someone in their path, with their passion. Just you're amazing. And so
Oh, thanks.
the reason that we're talking now is because you've helped so many people avoid surgery, and or even probably even more people not only avoid but post surgery, some things that
Mhm.
went wrong in surgery that happen. And we're talking and we're like, we more people need to know that there's other things that can be done to avoid surgery, or and because surgery leads to so many other consequences like opioids, and taking it even like a step back of like, because the question that I brought to you was like, Mel, if people don't see you, like what do they do?
Yeah.
And you answered, well, they drink or they take pain medication, or and I'm like, dude, that like blew my mind.
Yeah.
So Mel, can you tell us like maybe of a few or maybe just one story of someone that you have helped in kind of a situation, and like the people that you tend to help, like maybe someone's out here listening that is maybe seeking some help with pain. Can you shed a little bit of light on that?
Yeah. And you're right. There are millions and millions of people out there in pain. And when we look at statistical information, for instance, 4 out of 5 people, adults in this country, suffer from back pain. And for more than a third of those people, it becomes chronic, which means they're experiencing that for 12 weeks or more. What does that mean to somebody that has back pain and is chronic and also has a family to take care of, has a job that they need to do? It alters your life in many ways. And surgery is an option, but it is not the only option. And that's really the point that we try to drive to bring across to people. It's a great thing that surgery is an option, and some people really need it. But if we can avoid it, let's try to avoid it. I had actually a chance to work with someone who had a pretty invasive spinal procedure. It's called a laminectomy. And what they do in that surgery is they actually cut out a piece of bone in the lamina, the section, kind of the back section of your spine. So the reason that they do that is to alleviate pressure, because the doctor sees there's a lot of compression there. It's pressing on the nerves. So, hey, let's make room so that your back can move and you can have less pain. So, I met this person 6 months after that laminectomy. So they've now altered their body. And I asked them, well, how did the surgery go? This person said, for months leading up to it, I had a pain in my glutes, in my butt, every time I went for a run. And he's like, I like to run. I enjoy that. And I don't want to have that pain anymore. So the doctor said, okay, we can do this procedure. It'll help. You won't get that pain shooting down from your butt to your leg anymore. And a lot of people, I'm sure, are familiar with that sensation, right? So he says, okay, I'm here for it. So they do this procedure. There's a long recovery process involved. He woke up from that surgery and he no longer had that pain in his butt, which is great. But he had pain in his back that would not go away. And it traveled from the very top of his hip all the way up his spine. And now between that laminectomy, you also get fused. So that back is now locked into place. So you have a restricted movement that he didn't anticipate. And so that's very hard, because this person, by the way, happened to be entering their retirement and they were looking forward to playing golf, like, multiple times a week, and going fishing and all of these things. And so by the time they came to me, I'm not able to move the bones that are now fused together for obvious reasons, but we were able to use our forms of treatment as kind of a management strategy. So this person doesn't have to rely on medication to help balance that pain, because that pain is still there. But we want to make it so that they don't have to rely on prescription medication and they can have some semblance of normalcy. So yeah, they're back walking. They can play golf. They've had to modify their swing a little bit because you can't really twist the same way, but they're regaining that activity that was previously lost. And that's a post-surgical rehab story. But, ideally, I'd love to meet somebody before they've already gone down that path. But yeah, that's one person that we've been able to help.
Another person.
Yeah.
So yeah, a lot of you guys know that I tore my ACL, and I originally went to see Mel because I did some stem cell therapy, and a friend of mine, Jeff, had he had a shoulder injury that he had repaired with surgery, but it was still hurting him. And then you guys found out that it was actually his one leg was shorter than the other. And so he started using like shoe implants, and his life dramatically improved. And he raved and ranted about you guys. And so then I was like, let's see what these peeps can do. They can't hurt me. Like, so I originally went for the relieving the pressure in the ACL, trying to do everything that I could to help it. I wanted to avoid surgery. And then I was telling Mel about like all the pressure in my neck, because my neck sits like this, kind of like this. So when you're holding a ball, like or anything, right? Than it would if you're holding it this way, right? So this is my neck, and so I put a lot of strain on my neck, and sitting at a desk all day and being like this, all of y'all are watching, y'all are doing the same thing. So it's helped me really like relieve a lot of the tension and be nicer to people. And I know my C1 too shifts. It's like shifts a lot, and so it's helped me with my mood. It's helped me with with the use of a mouth guard too, because I do use a mouth guard. It's helped me a lot too. And breathing, you've told me about some breathing techniques to do that I'm not gonna lie, they're kind of hard to. It's kind of hard to do homework, with working so much. But you give me
it's a work in progress.
Yeah, so, and you give me all the tools, and I'm sure you have hundreds of other stories of people that you help, and I just love that you're so much about like holistic, and about like you have like oils on in your office, like you have like and you're so focused like I really feel like you care, like you're so customer and I guess patient focused. Um, and I just feel like a lot of places aren't, it's such a difference coming to
Yeah.
you.
I mean, you are every person that comes into our clinic is unique, right? The reasons that bring you to see me are going to be different than everybody else that comes to see me, right? So it's really important that whoever you see, whether it's me or somebody else, is responsive to what it is that you need. It is very much a patient or client focused approach. People appreciate the fact that what we do is not a cookie cutter type of treatment because we don't all need the same things. And I think you touch on something that is true for a lot of people right now, right? A lot of people are working from home. A lot of people are sitting at a desk. Their desk configuration is not always the best because we've had to make do, right? We've had to make do with what we've got. Um, and as we get tired, our posture shifts. Our head starts to lurch forward, which is what you were mentioning earlier. And every inch that head goes forward, it's more and more pressure on the muscles of the neck and spine. And so those muscles can do that. They can do the work. I mean, we are an awesome piece of engineering, right? But they get tired. And so that's when we start to experience those aches and pains. And we get a little salty when we don't feel our best, especially here in the neck, because you've got your brainstem sits right back there behind your C2. And it helps us with regulating our sleep. It helps us with doing things like drowning out all the ambient noise that's around us. It helps with, kind of regulating some of our muscle tone too. So when these forces are kind of conspiring against you here a little bit, it's important to have a look at those structures and kind of help to maximize what you have. So that's where a structural therapist, somebody like me, is going to come into play, and then hopefully we get to teach you ways to help you feel better longer. Because as much as I love Paula, I love to see you, I don't want you to feel like you have to be here all the time. Like, I want you to have the tools so that you feel empowered and that you can go, that you can go forward and do all the things that you want to do. Because that's what this is really about. It's not just a matter of making you feel better, it's making you feel better so that you can do and live the life that you want to live. So,
1000%. Thank you
yeah.
so much, Mel. Well, that is all that I had. Is there anything else that you kind of wanted to add? I mean, I did add some facts on, the prescription opioids and the
Mhm.
misuse of them and, drug overdoses and avoiding surgery is,
Ah,
a lot of post-surgery treatment includes the use of opioids to treat the pain. But
yeah.
the main thing is they call it pain management for a reason. They don't call it pain resulting or
Right. It's not
pain
a
quitting.
resolution.
It's not, yeah, it's
Yeah.
not a real solution. So,
Yeah.
and, and
I mean, I think about it for a second, right? Because we all drive cars, right? When the check engine light goes on in your car, you know that there's a problem. And
yes,
so you say, well, I got to take my car to my mechanic, right? So pain is very inconvenient. We don't like it, but pain itself is not the problem. The pain is an alarm. It is the check engine light that tells you something is wrong.
yeah,
And so yes, sometimes that is going to be addressed with medication, but that is kind of, that is sometimes masking what's really happening underneath. And so, if I were to leave somebody with anything, it's that, pain is something that is not to be ignored. It is
yeah,
an alarm bell, so listen to it. So whether that is a physical pain that requires the use of somebody like me or, your doctor, your chiropractor, whatever the case may be, whether it is something that is more emotional and it requires the help of kind of more of a mental health intervention,
mhm,
it's really important that you don't ignore that. Your body sends you a signal and, listen to it. It is there to
yeah.
help guide you.
Yes. Oh my gosh, Mel. Yeah, and you put it in such great terms. It's so true. A lot of us just ignore the pain, and some of us think it's okay for us to just go with
Yeah.
all this pain, and unfortunately, that can lead to even worse things, right? So if we don't address it, and it just keeps getting worse and worse, it's unfortunately going to be worse for everybody. So Mel, I appreciate you so much for being in
Oh,
my
thank you.
life,
I
and
appreciate you
I am
too.
now thankful for Dr. Paul who put you on this journey. Uh, but every time I hear your story, I get like goosebumps, and sorry for almost crying, but
Oh, that's okay. You know what? Sometimes I think about it, I start crying too. It's an emotional thing, and you know, it changed my life in a lot of ways. And so, and I'm very, as challenging as that experience has been and was, I'm thankful for it because it brought me here and it brought me to people like you. So, you know,
everything happens as it should.
everything happens as it should.
Awesome. Well, Mel, thank you so much for taking time out. I know you're super, super busy, so you probably have to run to another client. So I
Get
encourage
ready.
I encourage everyone to please follow Mel. She is right here in the Brandon area, and she's also expanding. Maybe,
Yeah.
I don't know. So
Yes, there's
follow
more to
her.
come on that.
Yeah, so follow her on Facebook. You have LinkedIn as well, Mel.
I do.
And so that you can be uh, up to date with all her developments. And if you are having pain, guys, she's super good about answering questions, and you can reach out to me, and I could tell you if it's something that it makes sense to talk to her about, or obviously you always seek the help of a medical professional if you're in an emergency, or if you need care from, if you need surgery, get the surgery. But if you can avoid it,
Absolutely.
talk to Mel. Always know that there's options, and we're just here to empower you to make the right decisions for yourself, because you have all the answers, right? Like nobody knows more about your situation than you. So we're just here to give you advice and empowerment and education so that you can make the right decisions for yourself and your family. So
Absolutely.
thank you so much, Mel. I
Thanks,
will see
Paula.
you hours, and I'm going to
Thanks,
end the
Paula.
broadcast. Bye, guys.